Well, there's been a lot of anger from our government at the decision by the British government to keep South Africa on a list of countries that require people coming into the UK from South Africa to spend 2 weeks in quarantine. The British government calls it its red list. It says that while it will accept people who've been vaccinated with the Pfizer and Johnson & Johnson vaccines from countries like Kenya and Pakistan, it will not accept people from South Africa who've been vaccinated with the Pfizer and Johnson & Johnson vaccines. Dr. Nicholas Crisp is the Acting Director General at the Health Department. Before he took that position, he was the person in charge of our vaccination program. He's probably still really in charge of it. Dr. Crisp, good afternoon to you, and thank you for your time. You're a health professional. You know our vaccination program inside out. Can you see any rationale or reason for this decision from the British government?
Good afternoon, Stephen, and good afternoon to the viewers. No, we don't understand what the rationale is, and we've been trying to find out whether there's something that we either haven't done or should have done that might have changed the outcome. We're very surprised that we have been dealt with in this way, but we can't really react until we understand what it is that would get us off the red list.
What's so strange is they seem to say explicitly that people who are vaccinated in certain countries will be allowed in, while people vaccinated here are not allowed in. And it's the same vaccine, right? If you get the Pfizer vaccine in the UK, you're getting the same vaccine here.
Yeah, sure. So obviously it's the exact same vaccine. It comes from the same plants. It's manufactured in the same way, labeled exactly the same. So we have seen questions during the course of today, does this mean we've got suboptimal vaccine? No, it doesn't mean that at all. We use exactly the same vaccines that are used in other parts of the world. So we can't understand why, if you are fully vaccinated in this country, that vaccination would not be recognized.
I mean, there's another issue here, as I understand it. The South African who's vaccinated can fly to Ireland and then fly to the UK, and you won't have to go on the red list. I mean, I'm probably less polite than you, Dr. Crisp, but is there a problem with the way the British understand science?
Well, as I said, we're not quite sure yet. I've been in discussion with one or two people during the course of the day to try and get clarification. And even the people I've spoken to from the British side are not certain what the reasons are and whether we've just been overlooked or whether there's something specific. And until we get feedback, and I know that our DIRCO has also been engaging with the High Commission from a trade perspective. From our perspective from health, we would like to understand if there's any technical information about our vaccination program or about the way in which we report and record what we're doing. I mean, the British government is a supporter of a lot of our health projects. They know how we work, and we have a very close relationship with them for many of our health interventions. So there would be no problem whatsoever with us meeting with them and presenting them with whatever data might be required to change this decision.
It's easy to see this as just a diplomatic spat. It doesn't really matter. I mean, it does, particularly to the tourism industry and our tourism industry, I mean. But there's another thing that underlies all of this. I mean, you were saying you've been asked questions, is our Pfizer vaccine, you know, not of the same quality as that being given to people in the UK? And this takes us straight to one of the biggest questions that you as the Health Department are dealing with at the moment, the vaccine hesitancy among many people. I mean, if you have a government of another country effectively saying, we don't trust your vaccines, that's the message that's going to be heard. This can actually be deeply damaging.
Yeah, well, we're not sure that that is the message that they think they're conveying to us, but it is a message that the public may interpret. So that's why it's important for us to understand. Is it that we haven't vaccinated enough people, and therefore that they believe there might be virus in circulation still? Is it something different? Because it can't be the vaccines, because everybody knows that we are using the same vaccines as are being used in every other part of the world. It's the same manufacturer. Our passing of the vaccine through the approval process in our regulator is done in the same way as it is in the UK. We have a strong relationship from South Africa with the medical regulator in the UK. So from a regulatory perspective, there's absolutely no reason why not. And we purchase directly, and we keep a record of the cold chain maintenance, the same as every other standard is kept. It all goes to our National Control Laboratory. So those are definitely not the issues. It may be something that is to do with the percentage of people we are vaccinating, that they may feel that we have people who are vaccinated who may still be carrying the virus. But until we get that kind of information back, we can't really respond.
Obviously, I must ask you about the vaccination rollout. We're trying to encourage as many people as possible to get vaccinated, and we see more and more work from government. The Deputy President, David Mabuza, has been meeting people. He's been getting sporting people together. Do you believe it's still picking up momentum? Do you believe that we are getting more people in to get vaccinated?
Yeah, Stephen, I think that this is going to be a constant uphill battle. We've been aware of it for some time, and that's why we have all these interventions. From the health perspective, we're extremely grateful that everybody from government and other leaders from business and religious leaders and so on are all pitching in and doing their bit to try and help to raise awareness and to convey messages to people that vaccination is a great idea and that it will keep you out of hospital and from getting sick, from being in ICUs and potentially from death. So at the moment we are sustaining our tempo at around 210 to 230,000 vaccinations a day. That's not the tempo that we would like it to be. We hear lots of stories from different communities about what communities like to see. We know that there are segments of the population who have told us they will only wait until the Johnson & Johnson vaccine is widely available, but it's not available at the moment in large numbers. So I think we remain very positive, and we will just keep on with the various programs and some new interventions that we are planning to try and get the numbers up.
Dr. Nicholas Crisp, thanks very much.